The temporal bone is a complex bone. It is a bone of the cranium, helping to protect the cranial cavity where the brain is located, and it has a large number of structures. So, for example, the temporal bone has a zygomatic process, which contacts the zygomatic bone and helps to form the zygomatic arch. This arch creates a hole in the skull, something known as the synapsid opening, which the ancestors of mammals evolved and which all mammals have. This provides room for jaw muscles, which attach to the lower jaw, to then attach to the cranium and thus be longer and allow for a more powerful bite. There are several processes on the temporal bone for muscle attachment. So the mastoid process, posterior to the opening for the ear, this is the anchor point for the sternocleidomastoid muscle, which attaches to the mastoid process, and when it contracts allows us to flex the neck and laterally rotate the head. The narrow styloid process of the temporal bone serves as an anchor point for several muscles and ligaments, often which use the term stylo in their name, such as the styloglossus muscle, which anchors tongue muscles, or the stylohyoid muscle, or the stylohyoid ligament. Also in the lateral view, you can note this one large opening, the external auditory meatus or external acoustic meatus, which is how vibrations collected by the external ear, the pinna, are transmitted towards the middle and inner ears through the auditory canal. The middle and inner ears actually reside in a space within the temporal bone. So the temporal bone houses the middle and inner ear, and the small middle ear bones, the malleus, incus, and stapes, actually reside within the temporal bone. After the inner ear processes sound or vibration or acceleration, the information is then transmitted to the brain through the eighth cranial nerve. And this passes through the internal acoustic meatus, leaving the temporal bone to then enter the brain. In this image, pipe cleaners indicate both the external auditory meatus, which is how sound reaches the middle ear, and then the internal auditory meatus, which is how the vestibulocochlear nerve then leaves the temporal bone where the inner ear is located to then bring information to the brain. The temporal bone has two openings or foramina through which blood vessels to the brain can pass. The carotid canal or carotid foramen allows the internal carotid artery to bring oxygenated blood to the brain. The jugular foramen is formed by the junction of the temporal bone and the occipital bone. It allows the internal jugular vein to drain deoxygenated blood from the brain and also allows for the passage of three cranial nerves, the glossopharyngeal, vagus, and accessory nerves. In these images, the red pipe cleaner is passing through the carotid canal, the blue pipe cleaner through the jugular foramen, so that you can observe both their entry and exit points. Most vertebrates possess a jaw joint between the quadrate and articular bones. In this animation, the red and yellow bones. Mammals, however, replaced this ancestral jaw joint with a new one between the dentary bone, here depicted in blue, and the temporal bone. So the mammalian jaw joint is a TMJ, a temporomandibular jaw joint. And the mandibular fossa of the temporal bone is where the mandible articulates to form this jaw joint. The temporal bone is a very complex bone, and it is referred to as a composite bone because it is formed as separate bony elements in the fetus fuse. These correspond to the ancestral bones in reptiles and other primitive vertebrates, which didn't have one temporal bone. They had a number of small bones in the temporal region, and these bones then fused to form the adult temporal bone. One can observe before they fully fuse the sutures which unite the portions, such as the petrosal part of the temporal bone where the inner ear is housed to the squamosal part which includes the zygomatic arch.